Well, we're at a fairly early stage using the UK IBD Registry. So we're putting information in at the moment, and the greatest benefits will come as soon as that's complete. But already at this early stage, we've seen some significant improvements in our service. So for those patients that we've already loaded up the initial information on, as soon as they phone through, just by taking their name or their hospital number, we're able to flag up all their relevant information at a click of a button. And that makes the consultation much easier. And it also means that we can direct their management much better when they're phoning through the Inflammatory Bowel Disease hotline. And the other benefits that we've seen so far are from clinic. We're able to create a letter and hand that over to the patient instantly. Many's the time when we go through various conversations in the clinic and they seem to understand it, only to walk away and possibly forget elements that we've discussed. The letter acts as a reminder about that consultation, but also gives them the information again so that they can fall back on it and reread it at a later date. We're also able to document when the colonoscopic surveillance is due, and that's creating work lists for us so that we are reminded in due course, and that will prevent us having to list them separately. Because it's a uniform structure with common language, we're able to audit just about any aspect, and that's only going to be beneficial for research in the future. So in the clinic context, I always tell the patients that I will be loading information up onto the computer, and they're quite happy with that. And the beauty of the database as it stands at the registry as it stands at the moment is it follows the natural history-taking process. And the questions that are asked are the ones that I would usually ask anyway. So they're familiar with the questions, they're familiar with the answers that we're looking for. But the database registry is structured in such a way that that information is formatted and can be used at a later date to audit and research just about any aspect that I'm looking for. Whenever you start with a new product, and particularly with a new database, there's always going to be that period of time when you're familiarizing yourself with it, and also that period of time when you're uploading data onto it. But actually with our particular experience, we found that fairly effortless. We already had a database that was ported over for us, and that was done fairly seamlessly. So that information doesn't have to be put in again, and all we're doing is topping up. So the Inflammatory Bowel Disease Database Registry is available on all computers throughout the Trust, which means that whenever a patient comes in to either ourselves or to the surgical team or to the obs and gynae team or through A&E, that information is available to those doctors instantly. And they can also backtrack and see what's happened in the past. That can only be good for patients and help their management for the future. It's helped us with our patients who are on self-management programs. We've also found it particularly helpful with auditing and benefit, especially when we're trying to target towards achieving the inflammatory bowel disease standards and also the targets set by the IBD GRS system. So I think this is the first time that we'll actually have a snapshot, an overview picture of inflammatory bowel disease in this country. And not just the incidence and the prevalence of the conditions, it will also give us a direct understanding of what medicines are being used from region to region. And once we have that overview and an appreciation of how unwell this group is at any one point in time, I think that can only benefit the support for inflammatory bowel disease nationally and increase its profile to ensure that adequate funds are given per trust and per region to support their inflammatory bowel disease services. One of the benefits that I can see from the Inflammatory Bowel Disease Database Registry, certainly for the future, is that it offers a single point of data entry from which other projects such as the Inflammatory Bowel Disease Global Rating Score aims to achieve the inflammatory bowel disease, national inflammatory bowel disease standards, and also remote management can all benefit from. And at the end of the day, that can only help cut the clinician's workload by reducing down duplication.